In '94, we immigrated to United States. I didn't speak English, and dance became that sort of, universal language that I didn't need to learn. My cha-cha was the same cha-cha in the US.
I was kind of meant to be a prima ballerina until I hurt my ankle at 16, which ultimately led me to make a decision to stop ballet and move on to something else, which was Latin American dancing, which that got me into Dancing with the Stars.
With popularity of things like Dancing with the Stars and dance shows in general, people started to realize how we are also the athletes that need maintenance.
The way medicine has become, it's like you're just focused in your silo of medicine, and it's not meant to be that way. If you have the abilities to work in all these silos, which I believe we do, but it sure is special when you can work as a team, to help people.
I organized a big seminar in one of my studios in New York. One of the people that came in was Doc's wife, Jocelyn, and I had spoken to this group about how my ankle hurt.
Joss gave me a call and said, honey, I'd like you to come back and take a look at Max. He's got some issues here. And he shows me his balance, and all of a sudden I see this guy who's supposed to be this great dancer who can't balance on one leg. My curiosity at that time was all of a sudden he caught me. And I'm thinking, you had something happen with your femur. And he looks at me and goes, I had a skiing accident and I fractured my femur, and yes. And that's kind of how we met.
About a week later, I just took a leap of faith. I flew out and I saw him for 2 days. That's how our relationship started.
First time I met Peta, I actually did not meet Peta. I spoke with her on the phone outside of the country.
So I'd just gotten off my birth control after 5 years. I went to Australia. My body started to blow up. It was like I was going to the gym twice a day. I didn't understand what was happening.
They sent me a picture and I'm like, there's something really wrong. And so I literally just hung up the phone, I called Doc, I sent him that picture.
If you're gonna remove something like that, all of a sudden there's potential for problems. Tremendous weight gain issues, it happens fast.
So Dr. Seeds got on the phone with me. We have 24 to 48 hours to turn this around, or you could be this weight forever. I start looking online and I could see all of these testimonials from women who have had their IUDs taken out and nobody has informed them.
He called straight to some pharmacy in Australia and he just started that process of getting the progesterone cream for her.
I actually gave him a formula to compounds and try to pull her out of this.
Literally slapped it on my arms, slapped it on my thighs, and within 1 to 2 days, I was back to my normal weight. It was insane.
We were really happy that we were able to help her that way, and then that's how that relationship started.
That first one, when I was 16, I pretty much had an ankle reconstruction back then. I had to have it redone in 2015. I was dancing with my friend Artem doing a solo. He threw me up in the air and I just didn't land on the bottom part of my foot. I landed on the side, and that's what broke the 4th ligament, and that was when I was like, I can't do this anymore. I have to see what's wrong. I have to put a stop to this and figure this out. My husband took me to see Dr. Seeds and said, we need help because we feel like this is going to be the end of my career. Dr. Seeds did say that. He said if we had left it any longer, I wouldn't be walking.
Her first surgery was when she was around 16. At that age, things are biologically in your favor to progress a little quicker. This time she's in her 30s and she's got everything, her life and career are riding on this.
I had a goal. I came to him and I said, I want to be back in 7 to 8 weeks. Can you do it? And he said, you're crazy, but we're going to give it our best shot and we're going to do it. He repaired the 4 ligaments. He actually put what he calls a piece of tape. So if my ankle ever rolls, it is holding my ankle in place. So I will never roll it. It will snap. The tape will snap before I roll my ankle again. And he did that without me even knowing. He put that in and he was like, I also did this. And I was like, wait, what's in my ankle?
And I started her on a protocol of peptides to work on the swelling, inflammation, and pain. My goal always is to improve cell efficiency, so to get her in the most optimal state I could. You know, I knew she wanted to go back to professional dancing. I knew she wanted to be, you know, she's the most elite female dancer in the world, and we wanted to get her back to that state.
And we did it. I was on like a treadmill after 3 days. I was jumping on boxes after 2 weeks. I was back in LA in 3-inch Latin American heels in 7 weeks, and I was dancing. People did not believe us, my producer and the show. For us to do it in 7 weeks was miraculous. I can keep up with the 20-year-olds that are on Dancing with the Stars, and I wouldn't be able to be there, I don't think, competing against all these other younger women without the use of Dr. Seeds, the miracle maker, and peptide optimization. It does sound funny when it comes out of your mouth when you say that. You say magic and miracle maker, but it truly does feel like that.
When Doc says magic, it isn't really the magic in the sense of the word that we all use. You know, it's not that sort of, you know, abracadabra, and now we pull the rabbit out of the hat. That's not the magic he's describing. He's describing as magical the process that isn't the process by which we've been doing things up until now at all. That to me is magic, and I think that that's what he refers to as well.
When you see changes in your body, you can see the effects of what his plan is doing to your body, and I'm so thankful for that. I wouldn't be here, and I don't think I would still be dancing if it wasn't for him.
My goal is your optimal health. I want the best result for you, and I know how to make it happen. And I give myself to patients where we, as most of my patients will tell you, we develop some really good relationships. It's a team effort. You know, my part's a little part, their part's the big part. That's where you know, I always talk about the magic or the things come to play. Well, when you have all those things together, that's when the magic happens for sure.